Duke University recently became one of the first institutions in the world to provide several patients with at-home bone marrow transplant care immediately following the procedure.
As soon as they get the transplant, they're discharged to home, where they live at home, and we come to the patient twice a day usually. They're getting essentially the same care they would in the hospital. We have a physician or nurse practitioner or physician assistant go out in the morning. He or she examines the patient, draws blood, brings the blood back to the laboratory. The bloods are run, and in the afternoon, one of the clinic nurses will go out and deliver blood products, electrolytes, antibiotics if needed for the patient.
This is the chair where I spent most of my time during my at-home care. Certainly, it was much nicer to be here where we have all our stuff. We don't have to worry about what we had taken over to Duke.
There's several major benefits. This is really a clinical trial where we're studying whether, if a patient lives at home, whether their microbiota, or that is the bugs we all live with, which are beneficial for us, remains true to what they have and that they do not acquire hospital type of bacteria, which we know can be harmful. There's a quality of life issue. We believe patients at home will be more active, will eat better, and they are living with their loved ones.
Being at home, you feel more like a normal person.
I think there's probably no other study which really pushes the boundary as this. We're taking a procedure which normally is done in the hospital. It's a very intensive procedure, and willing to take it out into the patient's home so that they could be cared for better.
Researchers at the Duke Cancer Institute have discovered a link between high cholesterol and breast cancer. The early findings show a byproduct of cholesterol functions like the hormone estrogen to fuel the growth and spread of the most common types of breast cancers, especially in postmenopausal women.
Most breast tumors, about 75% of breast tumors, are estrogen receptor positive. And even in postmenopausal women, there are minute concentrations of estrogens in the blood that are produced by fat tissues. We were able to show that by elevating cholesterol, we did, of course, increase breast cancer risk, but that actually it wasn't cholesterol itself. It was a metabolite of cholesterol that was made, and that this metabolite, strangely, functioned like the female hormone estrogen. So this suggests you can reduce your risk by lowering cholesterol either through pharmacological means with statins or through dietary modifications. But in the case of treatment, it also suggests that we can take away a major driver of breast tumor growth by actually co-treating patients with statins in the presence of current therapies. And so one of the immediate near-term clinical trials that we believe that needs to be done is to evaluate the efficacy of endocrine therapies like tamoxifen and aromatase inhibitors in women with and without a statin. Our data would suggest that a statin added to these combinations will increase the robustness of these therapeutic interventions and may actually delay the onset of resistance to these therapies. The data we have in animal models are extremely positive and supportive of this particular approach.
In 2010, Stephanie Lipscomb was diagnosed with glioblastoma, an aggressive type of brain cancer. She underwent surgery to remove the tumor, but it returned 2 years later. She agreed to take part in the first phase of a research trial where a modified polio virus is injected directly into the tumor. That was in May of 2012. 14 months later, the tumor continues to shrink without the use of chemotherapy or radiation.
The idea of using viruses to fight cancer is not new at all. It is at least 100 years old, if not much older. So the tumors, such as Stephanie's, is the worst of the worst of the worst you can imagine. This is a type of cancer that does not respond well to anything out there. So that we are seeing a response at all is remarkable. And then the type of response we have seen with Stephanie is the more astonishing.
So what we can see all over that was area where we knew you had tumor cells, and then here was also the tumor that we treated and how we can barely see anything.
So very satisfying as a scientist to see the predictions made based on laboratory work, to see that in an actual patient.
We are throwing everything we got at these tumors, and we have to even
get more aggressive on our research effort because for every patient where we have successes, we have others where we don't. And there's no time for celebration. It's our job to learn how it works.